crone, menopause, oh my gosh, perimenopause. Why is our first reaction distaste for the aging pelvic floor? I mean, I'm a little bitter. I'm very bitter. All of us are concerned about, these fine lines or wrinkles, and we have all these interventions to make our external look great, and we address it so many different ways. However, what are we doing to address the aging pelvic floor? True story. I advertised a class that said, pelvic floor therapy for menopause. Guess how many people signed up for it? Big fat zero. That title didn't work well. I think most of us are in denial that our pelvis and our pelvic floor and our insides are going through changes. But how are we addressing those? Well, we're really not. We're kind of ignoring them, to be honest. No more of that. So rather than just looking great on the outside, let's look great on the inside too. The best way to start addressing this pelvic floor change is to kind of associate what symptoms you have. If you're someone who has problems leaking, let's try bridges. But let's try bridges on a wall. Getting inverted often helps organs away from the pelvic floor so it has space to move, right? Because sometimes even our spouses or children might be a little too close. Organs do the same thing. Move them out of the way, and let's try bridging on the wall. But here, make sure you're not squeezing your butt and you're just flowing up and down effortlessly, moving these organs and the pelvic floor. Take a breath in to lift up and breathe out to come down. If you're someone who's experiencing increased bloating or changes in your belly, try these 2 exercises to help manage some of that bloat that may be happening more often after you eat, upon waking, or maybe with stress. My favorite ones are Happy Baby, single leg, and Sidelying, clamshell, planks. But why are these important? They address the belly in a 360-degree view and help minimize all those changes that are happening in there. You might have noticed that you have some hip tightness. Well, that happens to a lot of us. Whether you had a baby or your posture is slightly off and you favor one side, you have a history of orthopedic concerns, that's okay, not to worry. Let's get on our hands and knees and start moving those hips into and out of rotation. So how do we do that? Find that neutral spine and start bringing your feet in and out like a windshield wiper. Then stand up into that half kneeling position to give it a quick stretch and stand up all the way to give it that length and strength. You might be someone who has low back pain that just is not that painful where you want to go see a doctor, but it's definitely there. Try this. Let's bend forward and give our hamstrings a good stretch. First, take a look at your feet and have them hip width apart. Grab a yoga block or something of height in front of you. Tip forward as you try to reach towards your feet, and some of you may not be able to. Try to maintain your feet looking forward and take a long breath in to give that hamstring a stretch. From there, what I'd like you to do is to stand up and grab yourself a band. What I'd like you to do is take a side step out and squat down, trying to get below your knees, and then stand back up and bring your feet together. But be careful not to slide your feet together. Sliding your feet will actually increase more back pain. Lift those feet up and use those muscles to help stabilize that pelvic floor so you can finally have relief from that back pain. And if you don't have a band, just take a big step and try to squat down and then step back together. It is just as effective. You might actually be experiencing some shoulder pain, maybe lack of mobility, or maybe even diagnosis of frozen shoulder. That is associated with a lot of aging change to the pelvic floor. So how do we get that shoulder to move and correlate to pelvic floor relief? What I'd like you to do is actually take one of these long bands, put it around your shoulder as if you're carrying a purse, and then put it around that same foot. Let's try and balance here on the opposite leg as you kick this leg back and you tip your body forward. That downward compression on the shoulder helps reduce pain and inflammation in your shoulder, as well as helps increase strength in your pelvic floor. It's a gentle little compression that allows harmony and space to occur. And finally, if you're someone who's maybe having some pain during sex, it doesn't have to be something you hide from your partner. You can be honest and forthright and change positions. Or if that's not really working, grab a yoga block. Let's sit down on it together. If you don't have a yoga block, grab 2 or 3 towels, roll them up, and sit on top of it. what I'd like you to do is to have that yoga block in between your legs as you try to sit on your knees. If that's too low, I will show you the different ways you can start turning that yoga block to give you more height. I just want you to take some time to breathe. Breathing in to stretch everything and breathing out to stabilize. Try these exercises based on your symptoms, and you might have one or a lot or none, but these are great ways to start addressing that ever-changing pelvic floor.